Hi, everyone. I'm psychologist Dr. Traci Moreno. Today, we are going to talk about the mental status exam, MSE for short. And this is can be actually a little bit complicated, and most people have a difficult time with this in the beginning of their careers. But it is very important. Sometimes in the beginning, I think it just seems like something very tedious. But it is extremely important for a couple different reasons. One is it can help lead us to an appropriate diagnosis. And two, as a supervisor, when I'm reading, a mental status exam that somebody wrote, that MSE should give me, I should be able to visualize that client in my mind based on what you write in the MSE. So so this is really, really important, and you're probably going to want to take notes for this because there's a lot of information. So we're going to go through each one of these, and it is very important to use the proper clinical terminology. Okay, I see a lot of different variations out there, and there are some different variations, but at least make sure you are using the proper terminology and not just coming up like with your own descriptors. Okay, so let's go through these. And I put these are the main um, items in an MSE, although again, there are variables, but I'm going to go through just kind of like the basics. And they're usually pretty much in this order, again, variably. Okay, so let's start with mood. Mood is a descriptor of, what type of mood does the client appear to be in during that session. And all of this is a snapshot of just that session. Okay, so this can be, if somebody's fairly stable, this could generally carry over session to session and be the same. If somebody is a little bit more unstable, it's going to change. So, all right. So mood is going to be either how our assessment is, how we assess what mood they're in, or what they say the mood that they're in. So we can either put, so mood could be, let's say, sad, anxious, stressed, guarded, shy, angry, frustrated. It could be happy. Usually not if they're in session in therapy, but it's always possible. Okay, and so on. So those aren't, you're just going to basically describe that. Other people like to, when you ask a client, oh, how are you doing today? And they give you, a more detailed response instead of just saying like, oh, I'm okay. They might say, oh, I've been a little stressed lately, or, I've been overwhelmed or something. You can also quote that. Okay, so be sure you can also quote exactly what the client says. Okay, one of my biggest pet peeves with quotes that I see all the time is that they don't quote it exactly as the patient or client says it. So be sure, they wouldn't say, I'm trying to think of an example. They might say, I was frustrated uh, because of problems at work. And sometimes I'll get the quote saying, like, they were, or something like that. Probably not the best example I can come up with off the top of my head. But anyway, just make sure like your quote is exactly what the client said. And we only want to quote something that is unique and deserves to be quoted. So that might be even just the individual word of just quoting overwhelmed or frustrated or something like that. Okay, so let's move on to affect. This seems to be one of the harder ones for people because there are several clinical descriptors for the terminology that need to be kind of memorized and really understood. So with affect, Affect is how we're assessing their expression of emotion. Okay, so the options are, again, and there are variations to these, but there is euthymic, which is basically normal, right? Their expression of emotion was clear, accurate, normal, right? The next one would be, let's do labile. Labile is when their expression of emotion is kind of all over the place. It goes up, it goes down. You can go from sad to angry to anxious, back to sad again, things like that. Then you have a set of three, which would be constricted, blunted, and flat. Okay, so constricted, blunted, and flat are kind of on a continuum. So constricted would be if somebody is, they're just a little bit restricted in their expression of emotion. So you would typically see this if somebody is maybe kind of stressed or a little shut down, or maybe even shy or guarded, and they're just a little bit more, they're holding back on their expression, just a little bit. And then blunted would be that there's an even greater restriction in that expression of emotion. And then flat is no emotion at all. I mean, literally like complete monotone, no inflection, no facial, expression of emotion. So you want to be really careful with using flat, because this is very typical with people that have severe mental illness, like schizophrenia, and even that's not as common in schizophrenia. So the ones you're probably going to use the most would probably be these top three. And so remember, I was saying that this helps us with diagnostically. So, somebody who is labile, this is very common with people with bipolar disorder, or maybe it's something less severe. Maybe it could be like a PTSD, or maybe an ADHD, something like that. But it would be something that has kind of that more like, I relate it to, you have like depressive disorders where people become more restricted and blunted, right? And then you have labile, which is more like the anxiety, PTSD, the anger, the bipolar, things like that have that like where we're filled with that excess energy, and that's coming out in our form of expression, if that makes sense. So so you just want to be, again, really careful with this. So to add on to this, we're going to assess if it's euthymic and everything's normal. That's all you need to put is euthymic. You don't need to put anything else. But this is indicating that there's a problem with their expression, right? These bottom four. So now you want to go into a couple sub descriptors here. You want to say whether this expression of emotion is appropriate or inappropriate to the situation, right? So somebody could come in and be talking about some work-related stress, or problems with their marriage, and they could be sad or anxious and things like that. But then, or they can shift to talking about a trip coming up, or something, some sort of accomplishment or something, and they can be a little bit more positive and hopeful, maybe a little bit happy. And or they could start talking about the recent a death of a loved one or something like that, or and then maybe they can start crying. Well, their expression is labile, right? Because they're switching from different emotions fairly quickly. But is it appropriate to the situation? So you're kind of ruling out the bipolar disorder, or something like that. I'm just using bipolar as the example. but you're able to kind of rule that out possibly. So if it is appropriate to the situation. So, and the other thing you want to, the other subcategory is it congruent to their mood? So you would say congruent or incongruent to mood. Okay, so then you're going back to the mood and saying, how were they feeling? You know, if somebody is saying like, oh, I'm fine, but they're expressing, you know, they're crying, they're angry, they're stressed, but they're like, oh no, I'm good. Everything's fine though. Yeah, everything's fine. You know, I'm sure you've seen this before. So that's incongruent. You know, that would be incongruent to their mood. So the way you want to write this in the MSE is that their affect was labile, appropriate to the situation, could be incongruent to mood, whatever it might be. But that's how you would write it. Okay, so let's go to dress and hygiene and grooming. So their dress, if there's nothing really to comment on, you can say their dress was appropriate, right? So you could say it was appropriate. You could say in terms of, you know, or let's say for dress, if it was a little, let's say you could even say like, for dress, there's not any like clinical terminology for these, just for that descriptor. So you could even describe it as being like odd or bizarre even, or something like that. Usually the dress is appropriate unless there's, and again, this leading to thinking about diagnosis, the more severe mentally ill, it becomes more odd or bizarre, where they could be wearing, you know, a turtleneck in the summer, or, you know, or a tank top in the winter, or something like that. Or they could even be wearing like, you know, a hat or gloves when it's really hot out or something. So again, this is going to lead to that diagnosis of more severely mentally ill if the dress is anything other than appropriate. So grooming and hygiene, you can use if it is appropriate. You could put appropriate. If it's not, some of the descriptors, common descriptors we use is disheveled. Right. And that would be if they are, you know, just kind of like, you know, the wild hair, maybe dirty shirt, you know, because you don't want to write like dirty, although I have seen that before. It's not necessarily wrong, but I think disheveled is kind of like a more professional, you know, using clinical terminology to describe that. So let me see what else. It could be unkempt is another one, which these are kind of similar terminology. You could put that they are, let me think. Sorry, I'm trying to think of these off the top of my head. Hygiene, grooming. I mean, you could just put poor. But if you do put anything like poor, you want to try to describe it a little bit. You still want to try to add one of these descriptors, because poor could really mean anything, you know. So we want to try to get, again, you're trying to give us a snapshot of the client in that session. So okay, you probably get the point of that. I probably didn't give you a wide range of descriptors, but I'm sure you get the point on that one. Okay, so orientation. Orientation is assessing their level of being alert and aware, so to their surroundings. So it assesses time, date, and situation. Some places will do a place, but that's not common. Usually it's going to be these three. And it's written like this on the MSE. You would put a capital O times, and then if they are alert and oriented to time, date, and situation, you're going to just put 3. And that's that's what, everybody knows what that means. Let's say it's just 2 or 1. You're just going to put 2 or 1, right? But what you're going to do is you got to say what they're not oriented to. So you would put not oriented to, situation. Okay. So this, obviously, if somebody is not alert to time, date, and situation, and that would be like literally like, do you know what time it is? Do you know what, the approximate time right now? Do you know what time? It could even be, the date could be what time of year is it? Do you know what month it is? You would start with the date. You want to start specific, and then you kind of, if they can't answer it, you widen it out and go more general. So you could say, do you know the date today? Do you know what day of the week it is? And then sometimes with severely mentally ill, like schizophrenia, you would say, do you know what season it is? Do you know things like that? Situation is, do you know where you are right now? Do you know why you're here? Things like that. There are a lot of mental status exam where you would just go through and they give you the questions and stuff to ask for this, which in most agencies, that's probably going to be part of the procedure that you're going to need to do. However, once you get all of this down and you have this memorized, and now it's like just, secondhand to you, you really want to try to get this information, my opinion, through just talking with them. I think it's so off-putting to kind of be there with, our clipboard or our computer or whatever, just kind of like going through these questions of things. Just kind of throw this, you'll learn eventually to throw this stuff in just in your regular conversation and then be able to fill it out later. Okay, so speech is the next one. People mix this one up a lot too. It's not what they're saying. Speech assesses the quality of their speech. So basically, the most basic one would be to assess the pace and volume. So what you could say is they were, speech was average in pace and volume, right? You could write out volume. Don't use VOL. That's not a clinical term. So let's say it was different than that. So you could say that it was fast in pace and loud in volume. This would indicate, one of these more, the anxiety disorders, the bipolar disorder, something like that. Then you could say it was, or it could be slow in pace and soft in volume. This could indicate a depressive disorder or something more like that. So then there's some other descriptors for speech. So you can use pressured. With these other descriptors, be very careful, and you're going to use them more rarely because they are more indicative to specific, more severe mental illness. For example, pressured is very common for bipolar disorder. The thoughts are racing so fast that they can't get it out, as fast as they're thinking of it. And so it's very like pressured, and they're almost like flipping over their words because they can't get it out fast enough. And so you want to be careful because it's not the same as fast, right? Fast would be more indicative for like an anxiety disorder. Pressured would be more indicative to bipolar disorder, right? So, and once you start working at places and this starts to come alive, it may seem hard to understand now, just me describing it, but once you start seeing it, you'll completely understand it. You'll get it. Okay, so other thing, it could be other descriptors could be rambled, where they just kind of consistently ramble on. It could be stuttering. Obviously, if they're stuttered, it could be poverty of speech. Poverty of speech means that they're really not answering. they're really not talking a lot. It's like you're really trying to pull, you're asking these open-ended questions and you're doing what you can, but they're like really barely answering you. Poverty of speech could be indicative of a like schizophrenia or severe mentally ill, or a depressive disorder, right? People have a lack of energy with depression, so that's usually going to be, it's sometimes slow and soft in volume, or there could be a poverty of speech. But remember, there's a difference between poverty of speech and having a slow and pace volume, right? It's like similar between the fast and the pressured. So you want to make sure you differentiate this, because poverty of speech is obviously more severe, but you're just kind of putting this together. Not any one of these things can give you a diagnosis. So, but you're just starting to create a picture, and you're trying to, like, in the back of your mind, kind of rule out these different diagnoses. Because poverty of speech could be, that's very common with teens or kids, especially in the beginning of therapy, or if their parents are making them go to therapy, or the person in general, even if it's an adult, doesn't really want to be there, and they could just be not answering. Or they're just shy or guarded or something like that. So you really, again, just one of these isn't going to give you that diagnosis. You got to put the whole picture together. Okay, so thought process. There's a lot of different ones in clinical terminology here. Thought process, if all is well, it could be organized, logical, rational. Those are probably the three most common descriptors. If they're, and it's the process of thought, right? It's how well they're putting, with their words together to produce thought. Okay, so the next most common one is tangential. Tangential is when they will go kind of from one topic to another, but there is a link to the topics. Like there's a method to the madness, in a sense. So I'll try to give you an example off the top of my head. You could say, I went to this, I was on my way to work, and I saw this turtle on the side of the street. And oh my God, did I ever tell you when I was at the beach and we actually saw a sea turtle? And yeah, and we were at the beach and it was our anniversary. And then, so you see how you're going, you're like jumping to different topics, but there is a connection there, which leads us to the next one, which is loose. Loose is the changing of topics, but with no connection. Okay. And obviously, as we go down, it's indicating more severe mental illness. When they start getting loose, tangential could be just somebody who has nerves or is just very chatty. It could be indicative of more like the anxiety disorders, where, they might have the racing thoughts. So it's just causing them to, or like ADHD or something like that, where they just kind of, there's just like a continual stream of consciousness. Okay. But now when something is loose, and the ones after this, it's going to get more what we call disorganized. So anything other than organized. So all of these that I'm going to list, these would be disorganized. And please don't ever write unorganized. That is not a clinical term. It's such a pet peeve. It drives me crazy. So it is disorganized. Okay, so let's continue with these. So after loose, let's see, it could be perseveration or perseverating. It could be ruminating. Circumstantial. Oh, is that a T? Oh, sorry about that. Oh gosh, I don't know if that's a T or a C, but whatever. Okay, so perseverating is kind of like, where they kind of continue to talk about, it's very similar to ruminating, is like where they continue to talk about, the same topic. Circumstantial would be where they start with a topic, they go into other things, but they always come back around, right? It's a circle. They always come back around to that same issue. Like no matter what, they always seem to like make their way back to it. Then some other ones, which are very rare, would be like, just so you are familiar with the terms. But again, this is like more for people who are schizophrenic, and that could be word salad. Again, very rare, but this is where they're just using singular words, and when the words are put together, make zero sense. Okay, so it could be like um, roller coaster, salad, fox, like that. There's one called echolalia. And that's when they just repeat what you say. So you could say, hi Tracy, and then go, hi Tracy, and you go, how are you today? How are you today? So did you take a shower? Did you take a shower? Something like that. They're just going to like repeat. They're going to echo everything that you say. Again, very rare. There are a lot more of these, but these are really the most common ones you're going to use are, obviously organized, tangential is the second most common, loose. And then, you usually use one of these when people are frustrated, stressed, things like that. Okay. Which, anxiety disorder, things like that. All right. Okay, so attention and concentration. So on the MSE actual like assessments, they give you specific ways to assess this and things to ask people. Like they'll use for attention and concentration, they can use like serial threes, or if they're more high functioning, if the client is more high functioning, you would use serial sevens, which would be to like count backwards by threes or by sevens, and you can see how well they're able to do that. So these are pretty, this one's pretty straightforward. You can use that. There's a lot of agencies that don't like when we use within normal limits. So it would be within normal limits, or we would say WNL. Make sure, again, a lot of agencies don't want you to use that. So be careful with that one. But with attention concentration, you can put, adequate, poor. Well, this should have been the other way if I'm putting them in order. So it would be impaired and then poor. And you should, if it is anything other than within normal limits or adequate, with any sort of descriptor, no matter which one you're on, you want to try to make a note of how was it impaired. Okay. We left off. The next one is memory. So memory, we have short-term and long-term memory. You're assessing both of these separately. So with long-term memory, you're going to be able to get that information through doing the biopsychosocial with them, or even just like asking them the questions of, about their history and things like that. So you'll be able to see like if they know like dates and, timelines, or they, how much they remember from, their history. So that'll be pretty easy to assess. And the options are, you could say adequate, impaired, and poor. For short-term memory, on the MSEs, they give you, usually it's 3 words to remember. So the way you're going to do that in a session is use at the beginning, towards the beginning of the MSA, you're going to say, okay, I'm going to give you 3 words to remember. I want you to remember these, and then I'm going to ask you to recall them in a few minutes. And so you would say blue pencil truck. And you ask them to repeat them. Can you repeat those for me? They say blue pencil truck. And you say, okay, you remind them a second time. Okay, I'm going to ask you, remember those. I'm going to ask you to recall them in just a little bit. And so then you go through, maybe like 3 more questions or something like that. You don't want to wait too long. Maybe just, a minute or two, and you say, do you remember those words that I asked you? And you can see, and you can assess their short-term memory. So, but make sure you differentiate between short and long-term memory. And again, the short-term memory can also be described with adequate, impaired, and poor. Okay, so insight and judgment. These are often written together, but it doesn't have to be the same answer, right? A lot of times, most of the time it is, because a lot of times when people lack insight, they lack judgment. But I have, you can see where it could be where they have adequate insight, but poor judgment or impaired judgment, because they could say, well, I know I have the insight. Like, I know this, I know I'm making poor choices. I know I'm sabotaging myself. I know, like, they're acknowledging the awareness. They have the insight into their maladaptive behavior, but yet they're still their actual judgment. So, right. So this is the insight into like their own awareness. For more, if you're at, you have more severe diagnoses, this insight is not even about like what I'm talking about with their like inner awareness. This could be, do you know the medications you're taking? I remember that was a common question we would ask, and that would be like their insight into their treatment, something like that. Do you know what your treatment goals are? Something like that. So depending on where you are and, the level of severity and the diagnoses that you're treating, this will be assessed differently. So same thing even between kids and adults, right? It's a different type of awareness and judgment that we're assessing. So the descriptors for this would be the same. It would be adequate, not with a G, impaired, and poor. Every once in a while, you could do a good. That's usually in private practice, where you have mild mental illness. So, okay, so those are the descriptors. Again, you can do it together. You can say insight and judgment were adequate, or you could say insight was adequate, judgment was impaired, whatever it is. You can put them together or separate them. That's up to you. Okay, so SIHI. This is suicidal ideation, homicidal ideation. That's how we write it. So you're going to assess a few different things for it. You're going to say this, well, actually scratch that, because this is just for ideation. So, and all that means is, are there thoughts there? Suicidal or homicidal thoughts. You simply ask that by, being straight up front, saying, do you ever think, or, do you ever think about hurting or killing anybody? Right? They're going to, or killing yourself. Do you have any thoughts about, hurting yourself or others? That's what we would say. Do you have any thoughts about hurting yourself or others? So the options for here is denied or reported. So if it's denied, you would simply say denied SI/HI. If it is reported, you can't just stop there, right? So then if it's reported, that triggers a suicide risk assessment, and you have to go into that. And I have another a previous episode that is posted is on how to do a suicide risk assessment, and also how to document that as well, and how to also report that if needed. So those are all already posted. This is your mental status exam. All right, good luck. Bye.